Hi, I'm Dr. Mark Jagger, Clinical Director of Spine Advanced and Spine Specialist Clinics, and I'm filming this video to give a little bit of an update of our clinic's position and what we're doing to help regarding this COVID-19 situation. So, sometimes in life you're called on to make some difficult decisions, and this is one of them. Trying to decide whether to stay open or not. And now our clinics, for the time being, are open. And the reason being is last night I was looking through some of my association's recommendations with respect to clinics remaining open, clinics closing, and what we can do as chiropractors and allied health practitioners to help with this situation. Now, firstly, I went through the definition of essential care. Essential care is defined by the chiropractic profession and allied health care as pain-based care. So patients in pain are classified as emergency-based treatment. 98% of the patients that we deal with in this clinic are pain-based care. So that was one facet of the situation. The other facet was on the list of things that our association suggested that we could do to help with the situation. One of them is to occupy emergency rooms in family doctors' offices, diverting and helping with pain-based patients, with those with musculoskeletal conditions that chiropractors and physiotherapists can deal with. So, and being in those positions in emergency and in medical doctors' offices, they suggested diverting these patients to community chiropractors. And now I thought, well, if all the community chiropractors are closed, what is the point of having the opportunity to divert them? Because where are they going to end up? If they can't find anyone that's open, they're going to end up back in the emergency department. They're going to end up back in the medical doctor's office, which is exactly where they don't need to be right now for a couple different reasons. Those doctors and those nurses and those other allied health professionals dealing with the COVID situation directly do not need any more work right now. They do not need back pain. They do not need neck. They do not need knees, shoulders, any other type of pain, headaches. They don't need that. That is a place where chiropractors are uniquely equipped to help take the load off the healthcare system. And number two is if you're going into emergency departments, if you're going into the family doctor's offices, those are places where the majority of people are there because they are ill. If they're ill, there is a higher potential of you going into that, catching whatever it is whatever illness that other person is in there to get checked out with. Instead, if you go to a clinic that is more pain-based, there are less patients that are ill here. There are more patients that are just simply in pain. So I asked myself what I could do to help take the load off regular medicine right now, and that is to keep our doors open, to be available for you as a patient in pain if you need us, because then you don't go to emergency medicine, you don't go to the hospital, you don't go to the family doctor. You let those people deal with what they're dealing with now, and we'll take some of that load off. Now, where some of that feeling comes from for me is I played hockey most of my life. I'm a defenseman. My job as a defenseman is to keep people the heck away from my goalie. Right now, my goalie is the medical doctors, the hospitals, the nurses, the allied medical professionals that are dealing with the COVID situation. And I'm going to do my best to keep people away from that goalie if at all possible. If we're looking at a football analogy, I'm the defensive line, and I'm not going to stay on the sidelines waiting for someone else to do my job for me. I'm in there and I'm going to help the best way that I can. So chiropractors are defined as essential medical professionals when we're dealing with pain. Now, that brings me to if you're looking at coming in for maintenance adjustment, prevention, that type of thing, right now, it's best that you don't. If you're in pain and you need us, we're there for you. Now, pain being physical, pain being mental, emotional as well, if you need some contact. Now, respecting, of course, the social distancing rules and all the cleanliness, sanitization, all that type of thing, we have taken measures to ensure that. But if you need to talk to someone, which is a very real thing right now, some people are feeling very isolated and may just need a phone call, may just need a little bit of human contact within the respect of the social distancing rules. If you need to talk to someone, if you need some information, we have information. we can help you through this, and we're willing to do that any way we can. We don't want to stand on the sidelines. We want to pitch in, we want to help. We want to stand behind these medical professionals that are doing beautiful work to help keep us safe from COVID. We're going to be there if you're in pain. So feel free to contact us. We do remain open for now. That may change. If it does, we will let you know. It just depends on how the situation rolls out. If we feel that we're in more risk remaining open than we are closing, then we may make that decision later. But right now, we're staying the course. We're pitching in. We're helping the rest of the medical professionals by keeping pain patients away right now. Thank you very much for watching, and please contact us if you need any more details. Thank you.